Thank you very much. And I'm going to just spend a couple of minutes just summarizing the status of where we are, and then maybe addressing some of the things that I know are on people's minds. So first of all, obviously, we are still in a very serious situation. I mean, to have over 400,000 deaths is something that, you know, is unfortunately historic in the very bad sense. When you look at the number of new infections that we have, it's still at a very high rate. Hospitalizations are up. There are certain areas of the country, as I think you're all familiar with, which are really stressed from the standpoint of beds, from the standpoint of the stress on the healthcare system. However, when you look more recently at the 7-day average of cases, remember, we were going between 300,000 and 400,000 and 200,000 and 300,000. Right now, it looks like it might actually be plateauing in the sense of turning around. Now, there's good news in that, but you have to be careful that we may not be seeing perhaps an artifact of a slowing down following the holidays. So when we see that, we think it's real. But one of the things, and it's interesting, I'm sort of getting a deja vu standing up here, because I said something like this almost a little bit less than a year ago when we were talking about the acceleration of cases in the late winter, early spring of 2020, when we were having New York City metropolitan area being the epicenter of what was going on, that there are always lags. So please be aware of that when you have cases and then a couple of weeks later you see it represented in hospitalizations, intensive care, and then a couple of weeks later in deaths. So you have almost a paradoxical curves where you see something plateauing and maybe coming down at the same time as hospitalizations and deaths might actually be going up. So this is something that I just put on your radar screen. It is not an unusual thing